Hello, everyone, and welcome to Wizzo Talk. I'd like to thank all of my subscribers for your support. I appreciate it. And I forgot what else I was just about to say, but that happens when you go live. But we're talking about understanding hospice care. So I'm going to let my guests do our intro, and then we're going to get right on off into it.
Hi, everyone. My name is Naomi Hernandez, and thank you, Paul, for inviting me today. I'm the administrator for Navigate Hospice. We're a locally owned and operated hospice here in Temple, Texas. We're at 1208 South 31st Street, um, right next to Las Vica. So we're very proud of the fact that we are locally owned and operated. We opened our doors February 6th of 2023. We're CHAP certified and Medicare certified, and we're here to serve our community.
All right, outstanding. Well, I appreciate you coming on the show. So we're gonna get right on off into it because it's a lot that I don't even know about hospice care. So hopefully that you can break that down for us and break it down for the viewers that's going to be watching. And if they have any questions or comments, they'll put them up in the chat box, and I'll share them on the screen. And you have a chance to answer those. We'll go right on off into it. So what I like to ask you first is, what inspired you to get off into the hospice care business?
So I worked in healthcare for a lot of years. I was at Scott and White for over 20 years. So that's always been a natural draw for me. Um, but when I worked at the hospital, I started working in case management and met with people every day that were needing something before they left the hospital. So I talked to people about home health and hospice and medical equipment and things like that. So um, hospice was hard for me because I had had a bad experience in my life. And so one day, one of the local reps came up and said, "You should become a hospice rep." And I said, "No, that's not for me. I can't do hospice." um, and she said, "I think you'd be really good at it." And met with a company, and my husband went with me. The owner wanted to meet my husband, and he basically was trying to sell against me taking the job. He said, "You're going to work long hours. It's kind of depressing some days, and if your husband's not happy with you being on the road all the time and being away from home all the time, it's not going to work." And so I said, "Well, then find somebody else." And my husband said, "No, no, 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 no. She can do this. I believe it." And so he said, "Let's try it for 6 months." And I said, "Okay, let's try it for 6 months." And I've been here since 2009. So
That's good.
I had the opportunity to go to a session because we had to do ride with the different people that work in the agencies, and I had to ride out with an RN, and I just had to sit back and kind of listen. And we went to see this patient, and he was young, and back in the early 2000s, healthcare was different, and he had HIV, and he said, the nurse told him, she goes, what can I do to make your day better?
Okay.
And he said, "I miss the human connection." He said, "I nobody will touch me, and my mom won't hug me, and I need that."
Mm,
And she sat on the bed, took her gloves off, and just hugged him, and he cried.
mm,
And I knew right then and there that I needed to connect people like her to
right.
people like him. And that's how I knew that all the people that were around that had seen what I did and heard what I said, they knew that I could do the job. I
Exactly.
didn't even know
Yes.
what to do. So,
Yes.
um, again, that's how I got here, and that's my goal, is to bring people together when they need people like nurses and chaplains, social workers, volunteers, aides. A lot of times, we run into families who, it might be a husband and wife, it might be a mother child situation, or any situation. And those family members become caregivers. And it's a 24-hour, 7-day week job.
Right.
Honestly, you know, I love my dad, but I don't want to give him a bath. That's not something I want to do.
Right.
And and so if our service can provide that care so that a child can continue to be the child and not be the caregiver, then we've done our job.
Outstanding. That's good. Outstanding. So everybody saw it in you first, but and you were kind of like the last one to see it.
I was the last one to see it. Yes.
Yeah. Yes, but you found it. So, well, so what I like to do now, my next question I'm going to ask you, what is hospice care? Because in just explain it to us, let us know about it, because some people out there have the wrong idea about it, may not really know about it. I know very little about it, thinking that, they dying or whatever, and I'm sure it's not all like that. So I'm just opening the mic up to you and just tell the viewers now that's watching now and the ones that's to be watching later, what is hospice care?
Sure. So, hospice care is end of life care. Um, when a patient, when a person has gone to the doctor and the doctor says that they have a life limiting illness and there's nothing more that can be done, that's when hospice care steps in, because we are the highest level of care outside of the hospital setting. So we turn into the patient's ER. If they are in pain, our nurses are pain specialists. Our doctors are trained in taking care of symptoms and managing the care. So, um, hospice I mean, it is end of life care. However, um, Medicare sets a guideline that we have to follow, which is 6 months or less to live. But we have patients who stay on hospice for a long, long period of time, sometimes 2 and 3 years. And a lot of people say, "Well, what happens if I don't die in 6 months?" And well, I love what my nurse tells them. She says, "I don't see an expiration date on you anywhere. I checked you out, and I don't see an expiration date on you, so we don't
Right.
know." Um, but the truth is that we have what we call IDT, interdisciplinary team meetings, every 2 weeks. And that's when the doctor and all the nurses and chaplain, social worker, volunteer coordinator, myself, we all meet and we discuss every single patient that's on our service. And as long as that person continues to meet criteria, we keep them on. If they start to get better, then we let them know, hey, you're actually doing better. Your wounds are healing. Your symptoms are, getting better. So you may want to think about stepping down to a lower level of care like home health.
Right.
And so they graduate off hospice, but hospice is always there. So your hospice benefit never decreases and it never goes away. It just gets put back on the shelf.
Okay. All right.
So, Medicare Part A is what pays for hospice at 100%. There's no copays, there's no out of pocket cost or anything. And so, Medicare Part A also pays for hospital stays. So that if the patient's in the hospital, um, we we don't provide hospice care.
Right.
But if the patient goes home, that's when we provide care.
Okay. All right. And now home, so on hospice care, they're at home and you'll send a nurse out or a doctor or someone out what's the routine, every other day, daily? How does
So
that work?
the routine is on a typical schedule, you'll see the nurse, the registered nurse will go see the patient once or twice a week to start. And so let's say Tuesday, Thursday. And then the CNA, which is the certified nursing assistant, she'll go out and provide care on Monday, Wednesday, Friday. So it could be 4 to 5 visits a week. And in between those visits, you also get the chaplain and the social worker that come in. And then the volunteers step in as well. So,
Okay.
and then as the patient, they might have symptoms that aren't being managed well, or they're
Right.
getting worse, or they have anxiety, then our nurses will increase their visits. So everything is mandated by a doctor's order. So we have to ask permission from our doctor in order to increase or decrease our visits. So that's why it's important for us to have those meetings. And we do invite our families to either come into the office and be a part of the meeting or be on the phone and talk. We put them on speaker. And while we're discussing their loved one's care, they can be a part of our meeting. So if they
Okay.
have questions for the doctor or anything else, something that makes this a little bit different that other hospices in this area don't have is our medical director actually will go and see patients in their home or in the facility. And that's something that around here is just not seen. So
Right.
now he's a busy doctor, so we
Right.
do have the nurses have to schedule his visits with him so that they he gets to come when he's available. But the fact that he does it's amazing.
Right. Understand. And so I've already can feel the love and compassion and everything that you have for hospice care. So I'm sure your staff has the same feeling and the same lovingness and tender and loving care for the patients and all, huh?
Absolutely.
Right. Right.
Absolutely. The staff, I mean, my social worker, his name is Herman, and he just called me 5 minutes ago. He just left a facility. uh, he was helping a patient have dinner. You know what I
Right.
mean? It's not 8 to 5, 9 to 5. It's when the job is done.
Exactly.
We're 24
Outstanding.
7. So we have nurses that are on call in the evening after 5 o'clock until 8 o'clock the next morning, and they take all of our calls. And if they have to go out and make visits, they get up and go. 1 o'clock in the morning, 2 o'clock in the morning, they go.
I was
So
just about to ask that, so that's good that you answered that already. I have it in my question. So we
okay,
have some people watching right now, so I like to invite them out. If they have any questions while we talk about understanding hospice care, please put them in the comments, and I'll share them on the screen. So just to ask you about hospice care, is it for like cancer patients only, or you know?
cancer is the the most common, actually. Usually, by the time the patient has a stage 4 cancer and they've gone through chemo, they've gone through radiation, and all the alternative medicines, then they come to hospice.
Right.
But we do have patients who have Alzheimer's. We have patients with dementia, COPD, CHF. Our particular team has a respiratory therapist that's on our team. So we bring her in when a patient maybe is leaving the hospital that's never been on oxygen and they're brand new to having oxygen in their home. um, our respiratory therapist can step in and teach, and add that extra layer of confidence for the family so that they can be good caregivers to the patients.
Exactly.
So
Exactly.
any diagnosis that causes you to have a life limiting situation, that's a hospice diagnosis.
Okay. Right, right. Okay, all right. Well, I heard you talk about pain. So I just wanted to ask you, how do you address pain management for your patients, that's in pain? What is it that you can do for them like that?
So every patient gets evaluated from head to toe, and so it's very custom care. It's not just standard. Although we do have what we call comfort kits, and we do discuss those options with the family on the onset of the care. And the comfort kit is just what it sounds like. It'll have different medications in there for like pain, anxiety, constipation. I mean, anything that could cause the patient to not be comfortable for that day, for that minute, whatever. Um, but it's all customized, and that's when the RN coming in, our admissions take anywhere from 3 to 4 hours, maybe longer, because the RN spends time with the family, with the patient, looks at every medication that the patient's on, and they don't just say, okay, you are on 10 medications, we're going to stop all of those, and all you're going to get is this. No,
Right,
they actually look at everything so that they can come up with a plan between the patient, the family, and the doctor so that that patient can get the best care possible. So pain, I mean, there's morphine, of course, that's always the common one. Um, there's tons of
right,
medications that,
right,
and it also depends on allergies.
right.
If a patient has an allergy, we look at that and we find something else. And um, the nurses are really, really good at always being able to manage pain.
Right.
And if a
Okay.
patient can't swallow, or because pills, a lot of our medications are liquid, and or they can go on a patch. So
Okay.
they get really creative.
Right.
I see a
Are
question.
you okay? Go ahead.
Is there a difference between hospice care received at home and hospice care received in a facility? Yes. Um, Hospice care at home, of course, you're in your own home and the nurses are coming. Uh, but in a facility, we as an agency have to have a contract with that particular facility. And then you have to um, handle the room and board situation and things like that. So it's a little bit different. It's done, but it's a little bit different
A little bit different.
because um, the average cost of a nursing home stay is about $160 a day, and the families have to pay for that, and that can be paid by a secondary insurance or out of pocket. And then their Medicare Part A, it goes on the shelf. So if they're on hospice, that's who pays hospice. So
Okay. Hopefully that answered her question right there. Thanks for that question right there. So the family. So while you're there, your nurse is there, or your CNA is at the patient's home. Uh, Family, are they cordial with it? Are they kind of working your nerve, or are they just well relaxed? Have you experienced any difficulties with the families?
sometimes, and
Sometimes.
because it's the fear, it's the
Yeah.
fear, the word hospice. It feels like the caregivers that have been taking care of the patient all along, they're getting the hospice aide, they're getting the nurse, they're getting to talk to the doctor, they're getting to talk to the chaplain, the social worker. So they're like, it's almost like a sigh of relief that all this care is coming in. But then you have family members that are coming in to visit, and they're like, what? You know, my loved one's on hospice? No,
Right.
this can't be. This just can't be. And so then we have to take a step back and meet those people where they are, because they may not be mentally ready to see their loved, just to say goodbye.
Right. Exactly. And so is there like who's notified first, if that patient of yours passed? I mean, will you be notified or your administration, your staff, or how's that notified? Who's getting notified during that time?
So what usually happens is the family will the nurse, as they begin to do their visits, they'll begin to see that there's a change in condition.
Okay.
And so then they begin to tell the family, okay, based on what I'm seeing, maybe it's, they're not eating as much as they were, they're not getting up out of bed, you know, they're just, it's called a decline. Once the nurse begins to identify all of those types of symptoms, then they start preparing the family and they start telling the primary caregiver, they're saying, okay, call the rest of the family because they may not be here in 4 to 5 days.
Right.
When that happens, the nurses see the patient every single day.
Okay.
And if the patient goes past the five, we call it intensive care. If they go past the 5 days of intensive care, then they go back to routine care, which would be 2 or 3 times a week for the nurse. But if the patient were to pass while our staff isn't there, the family usually calls into the office, and the nurse goes and spends time with the family. They provide postmortem care where they clean the patient, they dress them. We leave a flower behind, and thank you. And we stay with the family and the patient until the funeral home gets there.
That's good. Yeah, that's it's good. Staying right there by their side. So I'm sure that's appreciated.
Mhm.
So, well, let's talk about is there any type of misconceptions about health hospice care? So people getting the wrong idea about it. So,
Yes, yes, that's all the time. Even as long as I've been doing this, and I have friends who do the exact same thing. Uh, there's still people out there that say things like, you know, so that means in 6 months I'm gone.
right.
So 6 months I'm gone, and we're like, no. Or they'll say things like, well, is your nurse going to give me a shot or a pill, or how's this going to happen? And I'm like, what?
Yeah.
I get taken aback a little bit, like, no, no,
Right.
nothing like that. um,
Yes.
or they'll
Yes.
say things like, well, are you going to stop all my medication? And we're like, no, we're not going to stop your medication because, you know, um, when a patient stops taking their blood pressure medicine, what happens? They don't feel well. If
Right.
they stop taking their insulin, they don't feel well.
Right.
So why would we do that? Now
Exactly.
there is times when towards the end of life, when none of that really matters. Getting your insulin 2 or 3 times a day, it that's not what the focus is anymore. You know, being pain free is the focus. But if the patient is up and walking and has good quality of life, that's what we want. Because hospice, you don't have to have a homebound status. So if you feel well enough to travel, travel.
Yeah.
All we need to do is see you once every 2 weeks so that we can make sure you have your
I'm
medication.
glad you mentioned that because see, I was just sitting thinking that if they on hospice care, they can't go anywhere. I mean, they had to stay at home, so they're free to go on and move around and do whatever, as long as you can still come in, visit, monitor, and stuff
Mhm.
like that. So I didn't know
Absolutely.
that. So that was new to me. I didn't know that.
Yes, absolutely. So we had a patient who, um, her grandson was graduating from college out of state, and our social worker made arrangements for another hospice in that state to see her at the hotel. And we call those our traveling patients. And so that other hospice, agreed to go see her. We made sure she had plenty of meds to get her to the trip. And then if she needed anything, she could call a local hospice while she was there to get care.
Oh,
So
okay.
it was a great thing.
Right. Okay. That's good. That's good. Then learn. I'm learning a lot myself right here also too. So I heard you mention that once if the conditions improve, then they can get off hospice and they go to like another level or something like that. You said.
Hmm. Yes. So, like I said, hospice is the highest level of care outside of the hospital setting. So, once the patient graduates off of hospice because they their symptoms get better or are better managed without hospice, or maybe they want to seek aggressive treatment. Maybe there's a new and improved treatment out there and they want to try it. They can come off hospice and go on. They can go on a step down, which is home health, and they can do that. And then if they decide they want to come back to hospice later on, they can do that.
Right. Right. Okay.
One of
Got
the other
some. Go
oh,
ahead.
I was
No,
going to
go
say
ahead.
one of the other misconceptions out there is that you have to have a DNR to be on hospice, and you don't. You don't. A
Okay.
DNR is important, but it's not a requirement to be on hospice.
Right.
So a lot of patients think, well, as soon as I go on hospice, I have to, you know, sign a DNR and things like that. But that's not true. The only thing that we tell our patients and our families is CPR going to be effective? If they bring the patient back, is it quality of life? Would they
Right.
want that? And if they say yes, then that's fine. The other thing is that, you know, my staff may not be there to do CPR. So we have to tell that caregiver, you have to be prepared to do CPR on your loved one until the ambulance gets there. And if you're good with that, we're good with that.
Understand. Okay, okay. That's something DNR and CPR and
Mhm.
everything. So that's good. I'd like to just give a shout out to I see we got some guests watching, so I appreciate some viewers watching. I always mess that up saying guests. You're my guests, they're my viewers. But so I appreciate you guys tapping in. If you've got any questions, please put them in the comments and I'll share them on the screen. So just to move on to, I know I told you I had probably like about 5 or 6 questions, but I've asked more than that. So but I just have a few more here. But
Sure.
just to ask, so you're seeing that patient for like I think you said like 6 months. So you're building up emotions and going by there and seeing them. So how does one deal with that when that person passed after you've been seeing them and caring for them all that time?
You mean for our staff
For
or?
your staff, for your
Oh, yes,
staff.
sir. So that's where our social worker and chaplain, they
Okay.
really step in, and we have in our office, we have memorial services, and we talk about our patients and the memories that they created um, with them, and we have open discussions, and that really helps to heal the void, because that's really what it is. It's a void. We see these patients, uh, the families, you know, every week, and we're used to them. They're used to us, and
Right.
then they're gone. And so we come to the office. We spend time. We might have lunch and just have discussions about, hey, how do you feel today? Are
Right.
you okay? And like I said, we have a great chaplain and social worker, and he really is a great listener, and he's really good at drawing out how you feel.
Right. Right.
So
Okay.
if we recharge.
Yes. All right. And y'all real hands on with them and just downright personal. So
Mhm.
that's good. That's hard to come by sometimes. So I was just watching someone talk about on the news when the doctor come in the room to see you, they spend more time on the computer typing than they do asking you or examining you or something like that. So and it sounds like you guys are like really hands on and really personal, downright personal. So that's good. So,
Mhm.
so the ask you, what is like the, and I think you mentioned this, but like, what is the primary goal of hospice care?
To provide comfort
Yeah.
and to provide peace of mind for the people that are caring for their loved ones. You know, that they're doing a good job, that, you know, that someone's going to be there at 2 o'clock in the morning if you can't sleep and you're thinking, I'm not ready to say goodbye to my mom. I'm not ready to say goodbye to my dad. I'm not ready to say goodbye to my husband, my wife, um, my grandfather, grandmother. And you don't want to say that to your loved one or to the rest of the family. You can pick up the phone and you can call and talk to our chaplain or social worker and have that conversation.
Right.
And, you know, providing the care that, um, like you and I discussed prior to the show,
Right.
um, uh, giving the opportunity for a person to stay a child instead of a caregiver, a wife, a husband instead of a caregiver. You know, having someone else be able to come in and spend the time to bathe, comb their hair, file their nails, all of that, so
Right.
that they can go grocery shopping, they can go get their own hair done,
Right.
and they know that we're going to be taking really good care of their loved one. It's
Right.
important.
It definitely sound like it. And tell everyone where you're located at again.
We are right here in Temple, Texas, 1208 South 31st Street.
Right. And the name of your business again?
Navigate Hospice.
Right. And I'm sure they can see it, but I just wanted you to kind of put it up there and put it out there to them again verbally. So, I mean, that's pretty much all that I have. So, but is there anything at all that you may, I know it's right on the spot, but that you can think of that you might like to leave with the viewers that I may not have asked, or something that may have came to you for them to know about hospice care? Because a lot of people don't understand hospice care.
Hmm. A lot of people think that hospice is the end, and I'm going to be honest with you. It can be. It can be. A lot of people will say, "Well, as soon as I put my loved one on hospice, they were dead within 3 days."
Mm,
But the likelihood is, and the truth is that their loved one should have been on hospice a year ago, but they waited so long. And you know, um, the fear, the fear factor, is hard to overcome. But just knowing that you can try it, and if you don't like it, you can come off of hospice. Even if you don't graduate off hospice, you can always stop the service. So
okay. I'm
what?
sure that has to be, I mean, I haven't experienced that, but for the doctor, I guess the hospital would say, there's nothing else we can do. We're going to put him on hospice. I mean, I'm sure that's something really tough and hard for the family to deal with. And then you guys come in there and it kind of seem like you guys can kind of ease that pain a little bit, like you were saying, to taking care of them so they can go and shop and go and do this and go and do that or whatever, because you coming in taking care of them. So I'm
Mhm.
sure that's something, I hope I never really have to experience that, but
Mhm.
that could be tough, to saying like they just giving up. But at the same time, people can come off of hospice
Yes.
and go to the next level and stuff like that.
Yes. Yes. You
So
you always have your options, and you don't ever lose your rights. And that's the biggest takeaway, is that, I tell patients, give us 2 weeks. When they're on the fence, I tell them, give us 2 weeks to show you who our team is,
right,
and to show you what hospice truly is. And if you don't like it, I'll call you in 2 weeks and we can stop the service. And I've waited for the call, I've never gotten it. And then when I call them, they'll say, "Oh, this is awesome. Like,
yeah,
I don't have to bathe my dad. I don't
right,
have to bathe my mom. You guys are doing that." And I that is great. My mom's not in pain. I was able to take her out to lunch, to dinner, to a movie. things like that, because pain is a real thing. And, you know, if we can take that pain away and minimize the anxiety, that person's a different person. And that's what we're about, is making that person feel good, and then everything else takes care of itself.
It's definitely listening that you talk and speak and all here. I can definitely tell you about the patient and not just about the dollar sign or about, yeah, put them on hospitals, let me get the money, whatever, something like that. It's seeming like you guys are really taking the time and you really care for them, and you love what you do, and your staff seems like,
Oh
and
yes.
you
Yeah.
24/7, they can reach out to you at any time or
Hmm.
talk to the chaplain. So
Hmm.
that's
Hmm.
that's
Yeah.
well said, well put.
We have a lot of experience. We're new to the area, but we have a lot of experience. Our nurses have been doing this for a long, long time, and our chaplain social workers, our aides. I mean, we, yes, thank you, Stephanie.
Yeah,
Hospice
yeah,
workers are real heroes. Yes, they are.
exactly.
Yes,
Yes.
they
Yeah.
are. They give so much of their time, and I tell them all the time, like, go, y'all gotta go home. Y'all gotta, save some of that for your for, for your family, and
Exactly. Right.
but yeah, they
Okay.
love what they do, and we love what we do, and that's why
I can tell.
we did it.
Right. I will tell. I'm glad your husband and everyone saw it in you, and your husband said, just do it. So
Just do it. That's what he said. He goes, just
yeah,
do it. Yes.
exactly, exactly. Well, that is all that I have for you. So do you have one last thing, or you pretty much done, or what you got?
um, if you are listening and you need us, we're here. Call us, even if it's just to talk. So that's
Outstanding.
it.
That sounds good. Well, we appreciate you, and thank you
Thank
for
you.
stopping. Thank you for coming on Wizzo Talk, and thanking all my. Let me see if I get it right all this time. My viewers for their questions and for watching. Also, and you always remember that it's 100% free to like, share, and subscribe. We appreciate your support, and y'all go by there and check our business out, because that sound like some. Even if you just want to give a call or have a question that we may not have covered now, so stop by, look them up, and give them a call. Did you have well, you can put your business number, but that's fine. They can ask Google.
Yeah, we have a website, www.navigatehhh.com. It's
Okay,
really
good.
simple. So we're there.
That's good. I didn't have that in my notes to ask if you had a website. So y'all check out the website. You have any questions? And once again, I'd like to thank you for stopping on. And let's see who is some. Okay, all righty then. Well, that'll work. But other than that, that's all been said. This is Wizzo.
Thank
And
you.
thank you guys for stopping in, and we'll talk to you later. Thank you.
Thank you. Thanks,
Bye.
everybody.